Hello and welcome to an episode of MedX. Today we'll be talking about diabetes in children and few symptoms that as parents you can watch out for to take preemptive action. First, of course, I'm sure all of you would love to know what the two types of diabetes are, and you'll be surprised to know that we are now seeing type 2 diabetes even in young children, as young as 11 to 14. Type 1, I'm sure you all know, is when the body pretty much stops producing any insulin. And although it might not happen immediately, but over a year or two, the body tends to completely stop producing. We know this from certain tests, and doctors will help you diagnose that. Type 2, on the other hand, is a more of a lifestyle modification concept where a little weight loss and things like that can help the body put the disease into remission. Type 2s, for more often than not, do produce sufficient insulin, but for other factors, the sugars remain high. Here are three critical ages that as parents you need to be careful. They are the sensitive parts of growing up between 4 to 7, 11 to 14 and 16 to 18. The child goes through growth spurts in these phases and certain genes may express. So the following symptoms that I'm about to show you may find their foothold in these areas and you need to be careful at these points in time. So the four key risk factors for you. Family history will always be a dominant factor in diabetes. So if one parent, both parents, either side of the family tree, grandparents and so on have diabetes, there will always be a chance that a child is at risk. To add to that, you add a lifestyle with absolutely no physical activity, not even the bare minimum of half an hour to 1 hour, and the risk starts adding. Third is a consistently unhealthy diet. Yes, occasionally eating food outside is not unhealthy by itself, but just when it becomes every day, or like children nowadays are pretty much exposed to junk foods all the time, and it's become almost a daily habit now to have these kind of foods. So if you start stacking 1, 2 and 3, then you'll end up with number 4. And number 4 is not just for a child but even an adult. It does predispose you to any lifestyle condition for that matter, but diabetes being a dominant one in that space. Here are 5 symptoms that you need to be alert about. The first is sudden weight loss, and we're talking significant weight loss, not just a couple of kgs here and there. So you have 35 kg children suddenly become 25. You have a 40 kg child becoming 30. So there's an 8 to 10 kg correction in an already thin child. This should alert you immediately that there's something wrong. Frequent urination, and a lot of parents tell us there was urine, in the bathroom there were ants. Ants typically go after sugar, so the urine does contain sugar, and this is one of the major signs that we have seen that parents have told us. Frequent thirst, naturally with frequent urination would come frequent thirst. Hunger pangs, with a lot of sugar fluctuation, the child does go through random phases of hunger and then no hunger. Mood fluctuations, as you all know, when we get hungry we do get edgy, so short temper. Early fatigue, parents also tell us that the child gets tired very quickly when they come from school. Taking long naps could be symptomatic of high sugars. There are 4 steps that you can take. The first one is when you're suspecting any of these symptoms, please visit your family GP or an endocrinologist. Following that, do all the prescribed lab tests. There may be additional panels that may be needed to distinguish between type 1 and type 2. Please get all of them done. Gain clarity on the type of diabetes that your child may have. Okay, and what's its future prognosis also, but get clarity first. Don't Google search too much on cures immediately. I would recommend you listen to the specialists. Get a plan in place. The thing with diabetes is it's not a uniform, unicentric, one size fits all treatment. It's typically a holistic view where the medical management has its place. There has to be a diet because a child needs to continue to grow. So you cannot underfeed a child just to keep the sugars low. And then exercise should be the bare minimum, but again, exercise comes with risks of hypoglycemia, so you have to be careful between if there's insulin, medication, low carbohydrate eating combined with high levels of activity. If a child suddenly starts, we could have problems. So these are 4 key steps that you should start if you notice any of the above symptoms. From a family perspective though, both you and your child need to learn the skills of diabetes management. This involves 2 key concepts. One is called SMBG, which means self management of blood glucose. A child should learn over a period of say 6 months to a year what their symptom is and what does it mean. So if they're getting a little blurred vision, if they are not feeling comfortable, they're getting certain fainting spells, they should start realizing that okay, at this time of the day my sugar goes low, I must have it. Or after taking the insulin shot, what happens? So learning to manage insulin and food on their own is a skill that every insulin dependent diabetic has to learn for sure. And even if they are medication dependent, they need to have clarity on how those medicines work and for how long they act. Again, the whole goal here is to prevent hypo. From a parent perspective though, you must create and maintain a positive environment. So I usually tell a lot of parents when they come looking for cures, and when there isn't one for an insulin dependent child, I tell them go for a vacation, celebrate life as normal with that child. Otherwise, most type 1s tend to have a feeling of guilt that they have brought something into the house which, even they can't seem to do anything about, and the parents are always stressed. So my suggestion would be let life continue normally. Yes, there will be the insulin pricks, there will be a few modifications in terms of the food required, but let it remain a positive environment. Okay, on that note, we shall connect next time. Hope this video is useful, and do let us know in the comments what topics you would like us to cover.